Good evening, everyone. This is Dan Marsalo, my presentation on understanding ventilator waveforms. So what are ventilator waveforms? They're graphic representations of changes in pressure, flow, and volume within the ventilator circuit. So we have two types. We have scalar, which represent pressure, volume, or flow on the y-axis versus time on the x-axis. And that's an example right there. And then you have loops, which represent pressure versus volume or flow versus volume. Scalar waveforms. So you have 6 basic shapes, where 3 are functionally distinct, which are square, sine, and then your ramp. So the most common one that you're going to see are probably going to be these two here, your decelerating ramp and your square waveform. So what can these waveforms tell us? Pressure scalar is a valuable tool with modes of like volume control when an inspiratory pause is used. You can determine and inspect compliance and changes in area resistance. And then also, you can see things like ventilator desynchrony and air trapping. So your pressure volume loops. These are really useful in setting your PEEP and your PIP. And they help evaluate lung mechanics, identify circuit leaks, assess patient triggering efforts. Your flow volume loops, which is right here. This is useful in identifying peak successive airway secretions and alterations in airway resistance. So diagnostic ventilatory maneuvers. You have 2 maneuvers here, which help determine things like compliance and air trapping. You have your inspiratory pause and your expiratory pause. So your inspiratory pause, with this maneuver here, your pressure waveform can tell you a great deal about lung mechanics. We use it to find our plateau pressure. And then your plateau pressure is used to determine dynamic and static compliance. And your 2 equations for compliance, your dynamic is tidal volume divided by PIP minus PEEP. And then your static compliance is tidal volume minus plateau, divided by plateau minus PEEP. Your dynamic compliance is usually going to be higher due to the increased pressure required to overcome circuit and airway resistance. So with your expiratory pause, this provides useful information regarding pulmonary mechanics as well, and this allows you to see things like intrinsic PEEP due to air trapping. So what can we learn from scalar waveforms? So this is kind of like your normal pressure waveform here. You have your PIP, which is this peak right here, that's your peak inspiratory pressure. And then when your waveform flattens out, that is your plateau pressure here, and that's your expiratory phase. So in the instance of increased airway resistance, you're going to see that PIP really shoot up, and it's going to be significantly higher. Your PIP's going to be, your PIP minus your plateau is going to be increased. And then your static plateau is, for your static compliance, it's going to be pretty much the same here. So when you have decreased lung compliance, you're going to see that increased PIP, but your plateau is also going to be increased, so that PIP minus plat is really going to be pretty much unchanged. And then so that's what you're going to see with the decreased lung compliance. So that's with your inspiratory pause. You're going to see that plateau pressure here. So with a expiratory hold, so when you release that volume and it pauses, this is where you're going to see if you have any intrinsic PEEP and air trapping occurring. Okay. So with intrinsic PEEP, you have your set PEEP here, so that's your +5. So if there is air trapping occurring, that waveform is actually going to be higher than your set peep. So if it's 5 peep higher than your set peep, if your intrinsic peep's +5, and your set peep's +5, and then your total peep's actually going to be +10, you're going to actually be able to see this in your flow waveform. So this is your inspiratory phase here, and then this is your expiratory phase. So in normal phase, as this hash line shows, you're going to return to your baseline before that next breath. When you have air trapping occurring, you're going to see that that waveform is actually going to be below the baseline of 0 here when that next breath occurs. So that means that there's volume still in there. So a couple things that you can do to fix this here is going to be increase the expiratory time to let them, get rid of that that volume all the way. So you can do that by shortening your inspiratory time, increasing your flow rate. So in the instance of increased airway resistance, if it's caused by something like bronchospasm, you can do something like bronchodilators to help treat that. So pressure volume loops. This represents a change in circuit pressure and circuit volume. Over the last 2 decades, they've really played an important role in designing protective lung strategies in the setting of ARDS. If the loop does not begin at a pressure of 0, that's in the instance of PEEP. So if, in like the instance right here, as you can see, your pressure, that loop actually starts a little bit higher. So if you have 5 of PEEP, it's actually going to start at a +5. If you have no PEEP, as you can see, it's going to be right on this line here. So the right side here going up, that is going to be your your inspiratory limb, and then the left side going down here is going to be expiratory side. That hashed line here, that is your dynamic compliance here. So what can they tell us about lung compliance? So in the instance of increased airway resistance, as you can see with this top graphic, your gray line here is like that normal pressure volume loop. Okay, so in increased airway resistance, you're going to see that required pressure to deliver that tidal volume is significantly increased. You can see how far that pressure curve is going out here. Okay, and it's a constant level of pressure going up. Okay, so then back to your expiratory, and then you're going to see a small decrease here in your dynamic compliance because it's reduced with the increase in resistance. Okay, so then now in the changing of compliance of the lungs, so the lungs become more stiffer, as you're going to see. You're not going to see that widening of that loop, but you're going to see that pressure is it takes a significant amount of pressure to deliver a volume, and you're going to see that the volume's actually smaller. Okay, and then you're going to see that downward shift of your compliance. So obviously we know if you have decreased compliance, that means that lung's going to be stiffer. That could be in the setting of something like, ARDS or, pulmonary edema. And then when whatever that condition is resolved, you'll see in the instance of increased compliance, you're going to see it takes a lot less pressure to get that higher volume in, and you're going to see the lung taking a higher volume with less pressure. And that shift of that compliance is going to be increased. Okay, so increased compliance, your lungs are less stiff. So, if the inspiratory limb is nearly vertical, this increases a constant inspiratory pressure. Okay, so nearly vertical line here, that's in that instance of decreased compliance. That nearly vertical line means constant pressure. When you see beaking in your pressure volume loop, that's really bad. That represents overdistension of the alveoli, and that's usually due to increased tidal volume. So really significant finding. So if you see that, you want to know that you're going to want to decrease that tidal volume so you're not causing barotrauma. So flow volume loops, importing and demonstrating excessive airway resistance in airway secretions. Top part here is your inspiratory phase. Bottom part is your expiratory phase, that peak before it starts to return to baseline. That's your peak expiratory flow. So what can they tell us? This top one here, so increased airway resistance when you're looking at that flow loop. If you start to see scooping on the inside, okay, that's an increase in airway resistance. So bronchospasm, mucus plugging, things like that, you're going to see with scooping. An instance of circuit leak, which you could see on a pressure volume loop as well. The waveform, that loop is never going to fully return to normal, and you're going to see a break. So that indicates a circuit leak. And then lastly, an instance of airway secretion. So if you see this, and you can see this with Scholar waveforms as well. If you see this like sawtooth pattern here, so in the instance of a Scholar one, on the top of that waveform, that decelerating ramp, you're going to see that jagged sawtooth motion as well. That increases indicates airway secretion, so you know that your patient probably needs to get suctioned, and also it could indicate some water buildup, rain out in your circuit, so you might have to drain that if you see that waveform and suctioning doesn't fix it. So 2 questions. How can you tell tidal volumes are causing overdistension of the alveoli on a pressure volume loop? And then true or false, with increased airway resistance, dynamic compliance will fluctuate drastically. So in summary, waveforms, they could tell us a lot of things about our patients. And it's, really good tool to have in your toolbox for being an RT. If you can decipher what those waveforms mean, really helps you in adjusting your ventilator settings to better suit your patient and prevent things like barotrauma, or if they need to be suctioned, or if you need to administer a bronchodilator because airway resistance increased and you need to try to treat that bronchospasm. Well, I hope you enjoy my presentation, and I'll look forward to seeing you next week.